I don't want you to be only a doctor, but I also want you to be a man.
Medical education with a community focus at Maharat, Nakhon Ratchasima Hospital, Thailand. In Thailand, the shortages of public health workforce, especially doctors, have continually been a problem, resulting in an imbalance between the number of doctors and that of healthcare recipients, particularly in rural areas. Maharat, Nakhon Ratchasima Hospital, one of the regional hospitals of the Ministry of Public Health, has been designated as an institution responsible for producing additional medical doctors for rural residents in collaboration with Mahidol University. Its Clinical Medical Education Center has been operational since 1999 in running the Doctor of Medicine degree program. Dr. Narong Apikun-Wanit, former director, Maharat, Nakhon Ratchasima Hospital, said that the collaborative project to increase production of rural doctors has a positive impact on hospitals and communities. It helps medical students to learn about real-life problems and create a linkage for delivering suitable medical and health services in a holistic manner. The curriculum of the program aims to produce medical graduates who can work efficiently and happily in rural areas, as the subject of family and community medicine is integrated into the 3rd through 6th years of the curriculum. Dr. Sorarat Remanu Wararat, orthopedist and Deputy Director, Maharat Nakhon Ratchasima Hospital's Medical Education Center, said that we want to produce medical graduates with the quality and capacity to care for patients' physical and mental conditions and understanding of the context of rural residents. Our short and simple philosophy is, we have to be doctors according to the national professional standards, who are able to live happily in rural areas for the benefits of the country. As it is a large hospital with a huge number of patients, there are numerous aspects of learning for medical students. Dr. Sorarat said that our strength is having the students see the real context in which they will work in the future, learning amidst real-life situations with the patients and illnesses similar to what they will encounter. At our hospital, we have got both simple cases and most difficult cases. The humanized care approach has also been integrated into all courses and learning activities aimed at enhancing physical, spiritual, social development capacity of the students. Importance is also given to the development of life skills outside the hospital for the students by having them participate in extracurricular community services initiated in 2002. Its purpose is to get the students exposed to the medical profession and experiential learning about people's real life that they will face in the future. Every 2 months, a community learning camp is organized in a rural community for medical students, medical lecturers, and other multidisciplinary staff members of the hospital, as well as health network members in the local community, aiming to enhance voluntary participation in giving health advice and medical services. A villager said that, "We are delighted to have doctors coming into our community to provide medical services. We have received advice about healthcare and exercise. Going to the hospital takes a long time because of the long distance. If we are not seriously ill, we will not go to hospital." A villager said that, "I have chronic gastritis and have ever visited a large hospital with a lot of patients and long waiting times. The doctors there do not have much time to talk to the patients. I am glad today to have the doctors coming here. They are friendly and can spend more time with each patient. Today I am here to receive a cervical cancer screening." Besides using the professional knowledge, the transfer of experience undertaken by the lecturers to the learners, from elders to younger personnel, is also the aim of this activity. Dr. Sorarat said that, "Being a medical doctor, a specialized profession, requires nurturing to become a good doctor by a model teacher in the environment favorable for fostering him or her. That is challenging for us." The experience in really working in the community and making home visits is another door leading to the learning about humanized care. Several case studies are regarded as living lessons for the medical students to learn and practice together with the medical instructors or mentors. Medical care and attention rendered to the patients as if they were relatives with willingness, compassion, and empathy has been instilled or passed on from medical instructors to learners and from senior medical graduates to students. Dr. Karunpong Pathamarut, psychiatrist, Maharat Nakhon Ratchasima Hospital, said that, "I am one of the graduates from the collaborative project to increase production of rural doctors. Participating in the Rural Medical Education Camp has created close relationships among medical lecturers and students. We have seen many good examples for the lecturers and gained direct experiences. That has changed our perspectives to view the patient as a real individual in the entire context, making us feel more sympathetic towards the patients and understand them better. If we were based only in the hospital, we would never have any understanding of their hardships. Those who have never been exposed to such conditions would never really understand the patients, and their different opinions between patients and doctors would never be compromised." Dr. Kunrudi Wongbenjarat, pediatrician, former rural medical camp member, said that, "During my first rural medical camping, I followed Dr. Sorarat, a medical lecturer, together with some other medical students, making a home visit to a child with cerebral palsy. Then I realized that the patient was not only ill, but his or her environment and livelihood had to be understood. My attitude toward the patients has changed. I began looking at them as a whole, not just focusing on the disease. I have changed from being an institutional clinician to becoming one with a community spirit and a holistic view." The after-action review is carried out by the students, telling the class about what they have experienced, their feelings, opinions, and camping activities. The key is for all students to see the importance of learning outside the classroom, as well as the linkages between health promotion and multi-sectoral teamwork. อุศรากร เพชรไพโรจน์ fourth-year medical student, said that, participating in the rural medical camp, I have seen the real lives of patients while making home visits, spending more time talking with them, and using open-ended questions. Having seen the real livelihoods and backgrounds of the patients, we have got a better understanding about them. More importantly, camping has made us review what we have studied in class again and become more confident. The learning for change has taken place through learning activities, after action reviews, evaluation, and knowledge extension. It has been noted that these kinds of activities have given a chance for the medical students to get exposed to the real health problems in the community, which help them relate to their preclinical studies in a concrete manner. อภิรักษ์ โคกนาดี fifth-year medical student, said that, personally, I have learned that in caring for the patients, we will not only focus on just the illness or disease, but we have to also see their physical and mental conditions, as well as their relatives or friends. Medical lecturers are our good role models, who can transfer the knowledge to us, in addition to what we have learned from textbooks. We can learn more from both the patient and lecturer simultaneously. The patient is regarded as the best textbook for doctors. The learning experience with actual practice, together with experienced personnel in the local community, has illustrated the integration of medical treatment, disease prevention, and health promotion on a full cycle scale. Moreover, the students have also learned about volunteer spirit, being givers and takers, and gaining knowledge, attitudes, and skills in community health promotion. This is accomplished in a systematic and efficient manner, as per the real intent of the institution in producing more medical doctors for rural residents.